The goal of masks, as with other personal protective equipment such as eyewear, face shields, gowns, and gloves, is to protect the healthcare worker as well as the patient. As with all healthcare procedures, always follow agency protocol for hand hygiene and the use of personal protective equipment. When worn properly, a mask may reduce the transmission of microorganisms, such as viruses and bacteria, from the wearer to the environment. A mask can be worn by the healthcare worker to protect a susceptible patient, or be worn by the patient to protect from the environment. Masks are also worn by healthcare workers to provide protection against infection spread through droplets. Masks should also be worn by healthcare workers to protect from accidental splash or spray of blood and body fluids, and for any procedure involving potentially infectious material. Masks are always worn in the surgical suite and during preparation for surgery. There are different types of masks available depending on the task and personal preference. Fluid-resistant procedure masks with elastic ear loops are used for any non-sterile procedure. Surgical masks are required to meet specified standards for protection against blood and body fluids and are available in two basic types. One type is flat fold or duck-billed, and the other is pre-molded and cone-shaped. The flat fold or duck-billed mask affixes to the head with two ties and conforms to the face with a flexible nose adjustment. The pre-mold and cone-shaped mask affixes to the head with elastic bands and has a flexible nose adjustment. N95 respirator masks are used when caring for patients suspected to have infectious airborne disease. This respirator mask prevents the inhalation of airborne virus or bacilli. Masks are only effective if worn properly. Masks should not be placed below the nose. Masks should not be worn around the neck. Masks should be changed if they become wet. Masks should be changed between patient procedures. To don a fluid-resistant procedure mask with elastic ear loops, first place the mask over the nose, mouth, and chin. Pinch the adjustable nose piece over the bridge of the nose. Secure on the head with ear loops and adjust to fit. To don a pre-molded surgical mask, place the mask over the nose, mouth, and chin. Secure on the head with the ties or elastic band and adjust to fit. To don an N95 respirator mask, place the mask over the nose, mouth, and chin. Fit the flexible nose piece over the nose and secure. Adjust to fit. With a respirator mask, it is important to perform a fit test by inhaling and exhaling. If fit properly, the respirator should collapse on inhalation, and there should be no leakage around the face on exhalation. To remove a mask, untie or pull the elastic band away from the back of the head. Remove from the face, avoiding contact with the front of the mask or any other personal protective equipment. Discard. If the device is designed to be reused, process according to agency protocol. Perform hand hygiene.